So there are two vessels in the forehead that you need to be aware of, the supratrochlear and supraorbital. The supratrochlear artery is going to be approximately 1.4 centimeters from the midline, and then the supraorbital artery is going to be another centimeter lateral. So there's 2.4 from the midline. And the way I like to look at it is first you can palpate where that supraorbital notch is. And I come from inferior to superior. And I'm going to turn on the power Doppler. And we already see it. So what we're seeing here is the supraorbital artery, and often it actually has two branches coming out, and we can see that there's two branches in this case. It's usually in the mid-pupillary line. So what happens? The artery actually runs along the periosteum as it goes into the forehead initially, and then at around 15 millimeters, it pierces through the muscle and goes more superficially. So therefore, it's much more dangerous to inject below the 15 millimeter from the orbital rim in a deep fashion because you're in the same plane as the artery. So generally, it's recommended that you don't inject below that 15 millimeter line because you are at high risk of disrupting that artery or injecting in that artery. Same thing for the supratrochlear. Again, that's going to be a little more medial, and that's going to be in this particular area right here. So there we go, that's the supratrochlear artery coming out of supratrochlear notch. So why are these arteries so important? Well, in general, obviously if you're injecting the forehead, I told you you don't want to inject within 15 millimeters of the but more importantly is if the patient has a filler-associated blindness. I would recommend trying to cannulate this supratrochlear artery and injecting hyaluronidase to try to reverse the HA that is in the retina. Okay, so let me do one last thing here. So let's see if we can trace these arteries in the forehead and see what levels they are. So I was about 15 millimeters from the orbital rim when I was doing this exam. And you see the artery is actually within the muscle. So the muscle's right here, and the artery's here. So as I told you, the artery comes out along the bone, but at about 15 millimeters, it starts to rise. So this is the supraorbital artery about the 15 millimeter mark. Let's go even higher, and you're going to see it even more superficial. I want to find it more superficial than that. So what we're seeing here is an evaluation of the forehead pretty close to the hairline. And I want to show you how the artery here is just beneath the skin surface, which is here. You see the lowest part of the dermis, and you see it's very, very close to the lowest part of the dermis, with the muscle being down here. So as I told you, it becomes almost subcutaneous as you go up into the forehead. So this is the supraorbital artery, subcutaneous in the upper forehead. So that concludes the evaluation of the forehead.